We developed a nanomaterial that can convert metabolic products of a pathogen into potent antimicrobials that can eradicate the pathogen, so that children with middle ear infections don't have to take oral antibiotics anymore.
Hello, I'm Emily Schneider from the American Chemical Society, and welcome to this media briefing from ACS Fall 2023. Back to school season means buying pens and paper, figuring out the new bus route, and earaches. Doctors typically treat these infections with antibiotics, but children sometimes don't complete the full course of doses. Cutting corners, however, can accelerate resistance to these medications. Today, researchers report developing a single-use nanoscale system that's unlikely to generate resistance. They show that it can kill off one type of ear infection-causing bacterium in test animals using a compound similar to bleach. We're joined today by Rong Yang from Cornell University. Thank you for joining us.
Thank you for having me.
So, Rong, what were you trying to find out with this research?
So we're looking to treat this extremely prevalent pediatric condition, middle ear infection, because it's the main cause for antibiotic prescriptions to US children. And our goal is really to come up with a solution that does not involve traditional antibiotics altogether.
And then how did you get the idea for this project?
So I really got this idea for the project from a marine organism called giant kelp. I remember reading this paper about how giant kelp can keep their leaves really clean because they have this enzyme that can turn really low level hydrogen peroxide in the ocean into a potent bleach. Then I was working on otitis media middle infection treatment at the time, that just had an aha moment, like what if we use this enzyme to turn the metabolic product from a common otitis media pathogen called Streptococcus pneumoniae, which also produces hydrogen peroxide, into bleach, essentially the active ingredients of bleach, that can act as really potent antimicrobials at a really low concentration, so it's still safe. And it's a continuous generation. So that's where we got the inspiration.
So, how did you investigate this?
So the thing about this nanomaterial is that it's really different from the traditional antibiotics, which are mostly small molecules. So the first thing we did is to see if it's effective, right? Because it works on such a different mechanism. So for that, we did the traditional catalytic activity characterization to make sure that it could act on the metabolic product that we're targeting, and convert it into the bleach-like ingredients very effectively. And then building on that, we then measured its killing efficacy, if you will, against the antimicrobial, because the idea behind this whole design is really to leverage the product of a living organism to kill them. So it's a kind of a self-propelling and autonomous process. And once we confirmed that it works outside of the body, we then introduce the bacteria into an animal, and then to make sure that the efficacy remains once the animal receives the bacteria and can develop this disease. But also what's very important is that the nanomaterial is biocompatible. It doesn't cause any damage to the ear tissue, for example, but also it doesn't impair the hearing sensitivity, that your ear is intact after receiving this treatment. So it's kind of the pathway that we went through to develop this therapeutic.
And then, yeah, I guess what was the big result? What did you find out?
So we discovered that this nanozyme can turn the hydrogen peroxide that's produced by Streptococcus pneumoniae, the pathogen we inoculated into the animals, to trigger otitis media into hypobromous acid, that is similar to the hypochloric acid that we use in the bleach. The treatment actually caused a 3-log reduction of the bacteria count in the middle ear of the animals, and that has been recognized as cure in human children because the immune system in the animals are somewhat primitive compared to ours. And the tissue in the ear remained intact. There's no signs of inflammation, necrosis, or other types of tissue damages. And we also confirmed that the hearing sensitivity remained unchanged after the animal received the treatment. So we think it's a very promising future therapeutic that could treat otitis media or middle infection without antibiotics.
When do you think that something like this could be available for clinical use? Could we ever see this like at the pediatrician?
That is my hope. I think it's gonna take some time to go through the more large scale efficacy testing and also the clinical trials, because we really want to be careful when it comes to children, to make sure it's safe and effective.
Of course. So then our clinical trials in the future.
Clinical trials in the future, hopefully.
So then what's the big significance of these findings?
So hopefully we'll be able to treat this extremely prevalent infection in children without antibiotics, right? And that means not only that kids don't have to take the antibiotics, which goes through their entire body to get to the middle ear, this little 1 milliliter space next to our brain, and don't have to suffer from all the side effects. But it also means that we'll breed less antibiotic resistance, and they will have because there has been established correlation between the early antibiotic exposure to health issues later in life. So hopefully there's less, they live a happier, healthier life later in their when they grow up as well.
So then what's the immediate next step in this research?
So the immediate next step is to deliver these nanowires across the eardrum into the middle ear, so we can deliver this therapeutic in a non-invasive way. So that is actually what I'm going to talk about at the ACS meeting. So we identified a few peptides that can transport nanorods across the eardrum, which is this really impermeable layer. If you think about it, it's impermeable to gas molecules even. That's because that's what causes the kind of the pressure imbalance when you take an airplane. So it's really impermeable, but these peptides seem really effective at kind of transporting these nanoscale structures across this impermeable layer. So we've seen pretty good permeability once we decorate the nanowires using these peptides, and we're hoping that this could lead to a one-dose topical application that is administered in the doctor's office, upon diagnosis, for example. So parents can just walk out that office without having to worry about any of the follow-up actions.
So the goal would be to have this maybe as a gel that's applied at the doctor's office?
Yeah, exactly. So the goal is to have a easy to administer formulation under room temperature, but to have the gel kind of quickly and firmly adheres to the eardrum once it's applied by the physician. Then it will stay in place and continuously deliver the nanowire into the middle ear throughout the usually a 7-day course of treatment.
Okay. And does it have to be removed, or does it just kind of go away on its own?
So that's a really good question. So the hydrogel, it should just go away on its own, because the way that our ear canal, the epidermis in our ear canal, kind of grows like a conveyor belt. It grows outward. So it should eventually just carry it's like earwax, carry it out from the ear. And the nanowire that makes it into the middle ear is delivered with the help of the peptide that I talked about. They should drain through the nasopharynx once the infection is cleared, and the eustachian tube is clogged during the infection, so that can keep the therapeutic in the middle ear. But once the infection is cleared, it will open up again, and then that provides a route of drainage for any residual nanomaterial, but also the kind of the tissue and the fluid and that's part of the immune response out of the nose, basically.
That's super fascinating. Well, thank you so much, Rong, for sharing your research with us.
Thank you so much for having me, for your interest.
Be sure to check out our other media briefings for ACS Fall 2023, which will be posted throughout the meeting at www.acs.org/ACS Fall 2023 briefings.